Hi, my name is Charlie Wray. I'm an assistant professor of medicine at UCSF and a health services researcher and hospitalist at the San Francisco VA Medical Center, and I'm affiliated faculty at the Philip R. Lee Institute for Health Policy Studies at UCSF. Right now, I'm thinking about the impact of the large uptake of telehealth and virtual care as a means of connecting patients to the healthcare system. As a VA health services researcher, I'm lucky to be a part of the largest integrated healthcare system in the United States, a system that was already at the vanguard in the use of virtual care, even before the onset of the pandemic. Within this larger domain of virtual care, I'm particularly interested in how the rapid uptake and use of virtual care technologies is impacting socially vulnerable individuals. For example, those who may be marginally housed, experience social isolation, or who lack higher education. In addition to this, I'm particularly interested in exploring how the proportion of virtual care, meaning how much of one's care is delivered virtually compared to how much care is delivered in person, and how this impacts health outcomes and the use of expensive healthcare resources, such as emergency departments and hospitals. Colloquially, we can think of this as an individual's digital dose. I'm currently in the early stages of work that aims to explore this topic further, with the hope of describing how one's digital dose, or the proportion of care, could be either helpful or harmful to one's overall health. I find this work interesting for several reasons. First, I believe the pandemic has caused the healthcare system to rethink the way it delivers its services. For the past 100 years or more, we've required patients to come to us to receive care. The virtual care revolution is forcing us in a very short period of time to rethink this paradigm and consider alternative ways to deliver care. Second, because we have quickly implemented so much virtual care over the past 2 years due to the COVID-19 pandemic, we must explore how the use of virtual care is impacting all quadrants of society, not just those who can afford digital devices or who have easy access to Wi-Fi. And third, I believe digitally based care will touch everyone if it hasn't already. As a health services researcher looking to have an impact on the healthcare system, I find this field to be extremely exciting. There are several health and health policy implications of this work. Like many others, I believe that healthcare systems should offer equitable access to care, whether that be in person or through virtual means. The work I and my colleagues are currently performing will hopefully elucidate whether we are accomplishing equitable delivery in the virtual sphere. And if not, how might we be able to improve that access? For example, we have a recent study that found that if we distribute video-enabled tablets to marginally housed individuals, we can improve both virtual and in-person engagement. Work like this may show healthcare systems that small investments up front may pay dividends down the line. From a health policy standpoint, work around virtual care is incredibly important right now, as both local and national policymakers are currently discussing how to manage multiple aspects of virtual care, such as which medications can providers prescribe virtually, who can be seen virtually, and how much providers should be reimbursed for a virtual visit. Even the simple question of what constitutes a virtual visit is being discussed. So you can see there's a large area of potential impact of this work, and I'm excited to see how we can move this field of research forward. Looking to the future, I'm incredibly excited about our work on proportionality of care, or the digital dose. Like most people, I believe that virtual care has a place in the current healthcare paradigm, but that we need to figure out where that place is. My hope as a health services researcher at UCSF and the San Francisco VA is to explore this topic further and see if we can shed some light on how healthcare systems can equitably and optimally implement virtual care.